Good morning, everyone, and welcome to the 16th Annual American Heart Association Worksite Wellbeing Summit. My name is Meredith Collette, and I'm the American Heart Association's Executive Director for Oregon and Southwest Washington. We are so excited to be able to bring today's event to you in collaboration with our local sponsors, OHSU Health, Providence Health Plan, and the Partners Group. The American Heart Association and our sponsors are committed to supporting employers as we continue navigating through these ever-changing times. We know that connecting with employers means we're able to improve the health and well-being of individual employees and their families. We have a full agenda this morning, and you will hear from experts across many industries. We hope that you leave today's event invigorated and ready to recenter and recommit to your organization's well-being goals. You can read more about our agenda and each session this morning in our digital flipbook. The link will be put in the chat. And don't forget that today's program offers SHRM and HRCI credits. So be sure to stick around until the end of the activity for your program IDs. I also want to mention throughout our program today, we will have scheduled wellness breaks, which we all need, allowing us to stretch, breathe, grab a snack, and mentally recharge. Before we start, I want to go over just a few housekeeping items. Today's event is set up as a Zoom webinar, so no need to worry about muting or unmuting or turning off and on your camera, but we do want to hear from you throughout the program. So please interact, comment, ask questions in the chat throughout this morning. Let's do a quick practice to warm up our fingers. Please type in the chat what company you are representing today and how many years you have been attending the American Heart Association Summit. IMA, Bridge Meadows, 1 year, 8 years, 16 years, 3 years. Nicole, 16 years. Awesome. Thank you all so much for joining. I love seeing, Nicole, you've been with us every single year along the way. As we begin today, I am really excited to invite Kimberly Smith to share with us why Worksite Wellbeing matters. Kimberly is OHSU's Health, Heart and Vascular Service Line Director. She holds a bachelor's degree in business from the University of Oregon, go Ducks, a bachelor's degree in nursing from OHSU, and a master's degree in health systems and organizational leadership, also from OHSU. She has over 10 years of experience in the healthcare field, all focused in cardiovascular care. As the Heart and Vascular Service Line Director, she has operational responsibilities over the Heart and Vascular Service Line, ambulatory practices, non-invasive cardiology, ventricular assist device program, and serves as a co-director of the OHSU Health, Heart, and Vascular Service Line. Welcome, Kimberly.
Thank you so much. Thank you so much, Meredith. I'm happy to be here and provide opening remarks. When I think about workplace well-being, I still do so through the lens of my role as a nurse. I think about the physical and emotional toll that a high stress or unsupportive work environment can have on individuals' total health. Our physical challenges don't exist in isolation. They're deeply intertwined with how we live, work, and care for others. As employers, we have a responsibility to cultivate environments that support whole person wellness. As Meredith mentioned, the American Heart Association has been producing the summit for 16 years, and its purpose remains clear: to connect HR and wellness professionals with each other and with the resources they need to support health in the workplace. Over the years, we've explored a wide range of topics, and this year is no exception. Today, we're diving into 3 timely and important themes: the rise of GLP-1 medications and their implications for workplace health strategies, the evolving needs of caregivers in the workforce, and the future of workforce wellness. These topics reflect the complexity of well-being today and the opportunity we have to meet it with compassion, innovation, and intention. At OHSU, we believe we can go farther together and reach higher when we welcome all types of team members. That means creating a workplace where people feel safe, supported, and seen. Whether someone is navigating a chronic condition, supporting a loved one through illness, or simply trying to maintain their own health, our workplaces must be equipped to meet those needs. When I was first asked to provide opening remarks for this summit, I found myself reflecting on well-being constantly: my own, my family's, my team's, and the patients we serve. As OHSU Health's Heart and Vascular Service Line Director, I'm responsible not only for ensuring patients receive the care they need, but also for fostering a culture where my colleagues can prioritize their own well-being. That includes recognizing the growing number of employees who are caregivers, and the unique stressors they face. It also includes understanding how new tools like GLP-1 medications are changing the landscape of chronic disease management and weight-related health, and how we as employers can respond thoughtfully. Well-being doesn't stop at the office door. It's deeply personal and profoundly communal. It's about how we care for ourselves and how we care for each other. And while the pursuit of well-being can feel overwhelming at times, it's also a powerful opportunity. The last few years have pushed us to reimagine what well-being looks like, and at OHSU, that reflection led to well-being being named a strategic priority in our 2025 planning process. We're focused on human sustainability, recognizing that well-being is not one size fits all. By joining us today, you've already shown that you understand the importance of well-being. You recognize your role in shaping healthier workplaces and communities. My hope is that this summit gives you a sense of connection, normalizes the challenges we all face, and sparks ideas for how we can move forward together. On behalf of OHSU, thank you for being here. Meredith, I'll pass it back to you.
Thank you so much, Kimberly, for your thoughtful look into the worksite wellness. To kick things off, I'm really excited to introduce our first discussion of the day, where we will explore how GLP-1 medications widely used for type 2 diabetes and weight management are shaping the future of workplace wellness. With that, I'd like to introduce Nicole Guilfoy, who will be our host for today. Nicole is an experienced total worker health practitioner and consultant for 20 years of experience in human resource safety and workplace health and well-being. She provides evidence-based education, coaching, and strategic support to organizations across the Pacific Northwest. Nicole is the president of the American Society of Safety Professionals, Columbia Willamette chapter. Welcome, Nicole. Thank you for being our host today. She's accompanied by our first session and panelist, Dr. Jessie Dunn. Dr. Jessie Dunn is a clinical pharmacy specialist working in the OHSU Advanced Heart Failure and Transplant Clinic. Her clinical practice includes management of all degrees of heart failure, ranging from early heart failure all the way through post-heart transplant care. She is a residency program coordinator for the OHSU PGY2 Ambulatory Care Pharmacy residency and contributes to education of pharmacy students, residents, and cardiology fellows. Nationally, Dr. Dunn is an active member of the ACC CVT team, Pharmacist Work Group, ASHP, and is the co-chair of Professional Education Committee for Pulmonary Hypertension Association. Nicole, I will turn it over to you to get us going.
Meredith, thank you so much. I want to thank personally the American Heart Association and the team for putting all of this together. I also want to acknowledge all of the incredible work that's being done at OHSU. I had my open heart surgery at Dornbecker in 1980, and it's such a thrill to see all of the developments and improvements and, sort of as we look toward the future of cardiac care. Dr. Dunn, it's an honor to be with you today, and we're really excited to get your insight on GLP-1s in the context of the workplace. So, GLP-1s have been a really hot topic, and I'm wondering if you could just give us just really quickly an overview of how they work, what the history of them is for, and what we are expecting to see in the future.
Yeah, absolutely. Definitely something that has consumed a fair amount of my time, as this is a drug class that is showing benefit in an expanding amount of disease states. But these drugs are just medications that stimulate a pathway our body already has. When you eat food, you take it in the beginning of your GI tract, it stimulates a bunch of processes to metabolize and help get rid of that food and get directed the way it needs to go. And one of the things it releases is GLP-1. And that substance tells our brain, you know what, we've eaten enough, we're full now. And it tells the liver, okay, get going, start processing things. It tells the pancreas to start processing things. And so this substance is already there. These medications all stimulate that same receptor that GLP-1 is potentially underactive in the body with. So that is the purpose of this drug class, is to just give that little extra kickstart.
Oh, that's so interesting. Thank you so much. From your perspective, how do GLP-1 medications fit into the broader picture of chronic disease management, and especially for patients with complex medical histories?
Well, that's the fascinating thing with these medications, is that we see that even something as simple as diabetes, which is not simple whatsoever. However, if that's all an individual has, we see a lot of benefit in preventing advanced cardiovascular disease when using this medication for those individuals with diabetes. However, we're also seeing an expanding role for these medications where it can decrease fatty liver disease, it can decrease chronic kidney disease progression and prevent progressing to needing dialysis. It can help with some heart failure symptoms. It doesn't have FDA approved indications for those yet, but it is something we have expanding evidence for. So there's a lot of, it's almost as if the more complex the disease burden that a person has, the more incremental benefit they get from these medications, because we are helping to counteract some of the dysfunctional metabolic processes that are going on in the body. And it all starts with your fat tissues being dysfunctional and then progressing from there to cause insulin resistance and kidney disease and heart disease and vascular dysfunction. And that can all lead to stroke, heart attack, death, heart failure. And so the earlier we catch it is great, but as the disease processes have started to progress, they still have quite a lot of benefit there as well.
You've mentioned kidney disease a couple of times, and I think when you and I were talking yesterday, it wasn't until I had my own experience that I understood really the critical nature of the kidneys in terms of cardiovascular health. Can you share just briefly a little bit about how that works?
Yeah, absolutely. So blood pressure in general is influenced by the heart and the blood vessels, but the kidneys really run that show. They get a lot of signals from the brain and from the heart and the blood vessels. And then they say, okay, increase blood pressure, decrease blood pressure, tighten up those blood vessels, reabsorb sodium and fluid to increase the volume in the blood so that we have more pressure in the pipes. And so they control all of that. They're also hardwired and they're affected by all of the same processes that cause heart disease. They're an extremely vascular organ. And so anything that can cause damage to the vasculature also causes damage to those kidneys.
Oh, wow. That's important for all of us to know. And especially considering blood pressure is such an inexpensive way for us to learn so much about what's happening inside of the body. Thank you for describing that for us. What are some of the most common misconceptions that you're encountering about GLP-1 medications, either from patients or from providers?
Kind of a little of everything. There's a lot of great information out there and some wonderful sources. However, I will say the thing I see the most is kind of twofold. One, I'm just going to use this medication for a little while, get the weight off, and then I can just use diet and exercise and maintain it. As an individual gains weight and becomes higher and higher in that body mass, the brain kind of rewires itself, thinking, oh, this is what my weight should be now. And it has a lot of biochemical markers that it stimulates to try to maintain that weight at all costs. And the GLP-1 agonists work to counteract that dysfunctional process. Every study that has been used for weight loss with the GLP-1s, when discontinued, individuals gain all of that weight back. So that's very, very difficult. It gets worse from there, though, however, because when they lose weight at an equal proportion of muscle mass and fat mass that they have in their body already. So if their 40% mass is muscle mass and 60% rest of stuff, it all comes down. And so we see that loss of muscle mass, we see that loss of regular mass, but when it's regained, it's almost entirely as a dysfunctional fat mass. Again, they don't regain that muscle mass that they lost during that time. So it's super important to make sure that people understand the implications of once we start these medications, you probably are on it for an indefinite amount of time, lifetime. Now, I'm waiting to see the studies on this. There's one that I've had my eye on for a while where they are investigating, yes, we got the weight off on these big doses. What if we bring it down to little doses and just administer small amounts along the way? Will that actually help maintain that weight loss and keep the metabolic functions where we wanted them with the gains that we've achieved without having to use big, expensive, cumbersome doses for these individuals? And can we actually keep people on it longer by using smaller doses and having fewer side effects? So that can be something that can be pretty useful there. Hopefully it turns out as a good thing. I'm I don't know if I have any reason to be optimistic one way or another, but I'm hoping that using a smaller dose might be a more manageable way to use these medications across a larger spectrum population.
You're describing sort of what I understand as like a theoretical set point.
Yeah.
And I think, that's kind of the question around this, that
Yeah.
most people who are looking for weight loss management, or maybe we don't quite understand, we might be hopeful that it can help to reset over time. But it sounds like that's not quite how it works in the body. We were talking yesterday and you said something that was brilliant. I've been thinking about it ever since. And that is, really what we're talking about is how your body chooses to use its energy. And I wonder if you can just describe that a little bit more for folks that are really, we're looking for, an easy solution, frankly, hopefully for some folks when it comes to weight management.
It's been a really big field of interest for researchers lately, where how does this increase weight gain and excess fat affect the entire body? And we're starting to delve into this a little bit more, especially because we have new tools in the toolbox. But as we have increasing amount of fat tissue in the body, we actually switch to a situation where we have too much fatty acid floating around in the body. And these free fatty acids, they got to be processed. They can be used for energy. They can be great for energy. And the tissues through the body, the skeletal muscle, the heart muscle, the liver, they all recognize this. And they start using, instead of glucose for energy, they're switching more to burning that fat for energy. When that fat becomes the primary energy source, we're not really using glucose anymore. And that leads to more glucose floating around throughout the body. And over time, you have more exposure to it. That glucose can go on to cause further damage. They can induce insulin resistance and then progress down the road to diabetes. It can also, when you have excess glucose inside the cells of various tissues, you can lead to a situation where it actually damages those tissues directly. You also have a situation where the body is like, oh shoot, I have to deal with this excess sugar. I'm using this for energy. Now I got to deal with that. And it's so busy storing away and processing and dealing with sugar that it doesn't actually take the time to repair the vital pieces inside that cell anymore. And so over time, that leads to more damage. And that's what helps progress this kidney dysfunction, this heart dysfunction, vascular dysfunction, and go down that cardiometabolic pathway. So hopefully in the next quarter, we'll have some guidelines coming out. I'm very optimistic. It's supposed to be first quarter 2026 on managing cardio-kidney metabolic disease, because it is so very intertwined. And I anticipate that this will be discussed a lot more in depth at that time.
Oh, that's very interesting. I think one thing that's a little bit concerning, I think, for some folks is that it's easy these days to go online and get a prescription for a compounded version of some GLP-1 medication. What are your thoughts about that? And what do you see in terms of regulations in the future?
Well, I know that the FDA is already trying to crack down a bit. Early on, about 2 years ago, when we first started to get a clue about the cardiovascular benefits of these meds, we went through shortages of many of them. And during that time, a lot of the compounding pharmacies we're seeing online or various places now started to get their hands on some of those high concentrations and dilute them down and then sell them online for those purposes. Now, the FDA does allow, like, people have individual needs. We are allowed to, in a compounding pharmacy, produce doses that are not commercially available because we need to meet the individual patient's need. So it's viable and it's absolutely okay. And at the time, we didn't have those standard doses available. People were waiting months and months to be able to get medications filled. Very difficult situation. They were shopping around different pharmacies, sending prescriptions all over the place to try to get access to this short medication. Well, the shortage is over for the time being, and they've figured out how to get the production up to meet those needs. And because of all that, the FDA has said, okay, now we don't have a supply line issue anymore. Now we have access to these things. You have to go back to the old rules. And the old rules say, if it's commercially available product, you are not allowed to produce it in a situation where a patent exists. So that is the situation we're in. So many of these pharmacies will still offer different doses. They will still be diluting, but instead of like semaglutide of 0.02 or 0.25 to 5 milligrams as the normal dosing range, they might do 0.375 or 0.75 and kind of split the difference and hit that middle road dose that's not commercially available to an individual. So we are seeing that as one avenue. Now, getting access to medications is great and the cost comes way, way down. And I do appreciate that as a person who wants to just meet the needs of the health of the individual that I might be working with at any given time. I do always say there's a little bit less regulation in some of these avenues. So they should be produced in a sterile environment. And in most times that is being done. There's definitely been compounding situations in the past with compounding pharmacies having non-sterile products leading to contamination or a maybe less potency than they thought was in there because of errors in production, because they don't have that microscope on their production line the same way the microscopes on the big manufacturers. So it is a little bit different. There's something to be mindful of. Hopefully you're getting what you intend to do. Hopefully everything's being produced in a very sterile environment. But I do anticipate the FDA will continue to get pressure from the companies that own those patents to make sure that compounding pharmacies are sticking to the existing rules for that. So could be useful, could be helpful. It's a tricky situation.
It is, and it's concerning because I've recently learned a new term related to GLP-1s, and it's gray market. Is this something that is discussed in the pharma world?
I'm sure it's discussed in many boardrooms in many of these large companies that shall go unnamed, but it is something that's definitely happening. See a need, fill a need. It's the nature of a healthcare system that still involves some degree of business and influence. And so it's, it is what it is. And we live in this world, and it's just up to us to make sure that individuals know the risks that they may or may not be taking when they use these products.
Oh, I appreciate that. And that's exactly why we're having this conversation today. With all of these issues, compounding, gray market, FDA approved GLP-1 medications, what should employers know when they're evaluating coverage options?
Yeah, there's differences in sizes of employers and how much influence they may or may not have on the insurance plans that they have for their individual employees. So larger companies might be what they call self-insured, and they get to set the terms of what they will cover or not cover. I think it is appropriate to make sure that we are using these medications in a judicious way. Keep in mind that someone might have lost a lot of weight and be in a normal BMI now. And if we suddenly say, well, you're fine now, we need to stop it, they're not going to continue necessarily to be fine with their weight and keeping under control. I think absolutely, as a person has more concomitant diseases, it should absolutely become available to them. Treating things like sleep apnea. There's only one medication to treat sleep apnea in addition to their usual breathing machines for overnight hours, and that is a GLP-1 agonist. And so that can dramatically improve sleep apnea, and sleep apnea being treated well can decrease risk of heart attacks and strokes and other cardiovascular disease. So, making sure that we're looking at that global picture is important. Some of these agents have a wider range of FDA-approved indications than others. And so if you're setting your formulary, think about what's going to benefit the majority of your patients would be really smart. Like semaglutide has a few more indications than tirzepatide. Liraglutide is also a great agent for the majority of individuals. There are some niche circumstances where we don't know if it's going to be beneficial or harmful for liraglutide. And so keeping in mind what the greater majority of your employees have available can be good. Heart failure with preserved ejection fraction is an interesting disease state that we're seeing, and it's quite common in the world nowadays, and it's very much tied to obesity and diabetes and dyslipidemia and other chronic disease states. And there's a definite improvement in day-to-day functioning with those agents. So individuals in the studies who received that medication had a huge increase in their 6-minute walk test. So like they could walk 40 more meters in 6 minutes, and that's a lot bigger than many drugs have been able to achieve in the past. And if your employees are able to get around better and be more active and have less fatigue on the job and a little bit fewer symptom burden during their day, then absolutely, you know, like from an employer standpoint, like healthy employee is a more productive employee to be to put it very frankly. And some of these medications can be useful in that aspect.
So as a workplace well-being person, I wonder, you know, if somebody's not, if somebody's on a GLP-1 and they're not eating much, and let's say they have a physical job, what do employers need to be watching out for while still respecting individual privacy?
Ooh, that's a great question, because individual privacy is always important. And, you know, we could have eating difficulties in many individuals, especially our lower income employees who might have food insecurity for one reason or another as well. Making sure employees get access to breaks, making sure that they are mindful, like, hey, we want to make sure you have the energy you need. I think it is important. I think it's important for healthcare providers who are prescribing this to tell people, you're not going to feel hungry, but you're going to have to make yourself eat some, and really have them work with their physicians. Like maybe if their work is starting to suffer a little bit for one reason or another, you know, you don't need to pry, but you can say, is there anything I can do to help? I've noticed that you seem to be a little lower energy than usual. Is there anything we can do? Is there something we can assist or address? And then you leave it in your employees' hands to disclose or not disclose. It's, you know, their right to say what they want to say. But if they're aware that it's being noticed that maybe your energy's down or you're not eating enough or keeping up on things, that can be important. I think it's also super important to encourage, you know, it's a very manual labor job. Just encouraging, hey, everybody needs you to make sure you're eating and drinking enough to keep up on this, because it's a lot. There are some circumstances I've encountered where some people, in addition to losing that hunger, they sometimes don't feel as thirsty as they normally would either. And so I always remind people to make sure you're paying attention to how much you're drinking. And if it's hot outside, make sure you're doing extra, because you're losing more fluid than you realize. There's a lot of cravings that are down regulated in that aspect and can be very useful, but people need to know that it is a possibility. So just encouraging in those manual jobs, like get your snacks when you need them, get your drinks when you need them. Don't ignore nutrition in these time periods.
It's so helpful to have a little bit of scripting from you on that, because I do think it's hard for employers, and especially in certain industries where, you know, we might have a social dynamic that doesn't, you know, make it really feasible for people to be open about that. And, you know, it's really important when we're talking about workplace well-being to really ensure that folks understand their benefit plans. And we'll talk about this a little bit more throughout the day, because I really can't stress enough how important it is that those mid-level managers know how to direct and support their employees. So, you know, again, the biggest thing that we're hearing about with GLP-1s is the cost. I mean, it's just so expensive. And, you know, pharmacy costs are continuing to increase sometimes for good reasons. We have some incredible new biologics that are on the market that are really effective, but they're super expensive. So pharmacy costs in general are going up, but we may see that it, you know, it's really helping folks with devastating disease. So, you know, given that, employers, especially the self-insured ones, are going to have to make a choice about, you know, what are they, you know, willing and able to do. So are there any emerging trends in pharmacy benefit management that could help employers offer GLP-1s more affordably and responsibly? Now, when I say responsibly, maybe that means something like ensuring that it's, you know, an FDA approved medication. Maybe it has to do with ensuring that folks who are taking it for weight loss are also getting counseling to ensure that those check-ins, that their, you know, eating patterns are on board, that they're not going into some sort of an eating disorder state. So there's so much to say about this, but what have you got?
I know, and we could have gone on yesterday forever.
We could have,
yeah. So I think it is important that individuals have access to dietitians. They have access to ways to get meaningful cardiovascular exercise as tolerated as able. I've worked for companies where they've given us discounts to the gym, and they've given us discounts to, or they've made a dietitian available through our employee health services. So those of us who might need a little bit extra help on that avenue have access to that right there on the spot. I think having a good dietitian around is worth its weight in gold for sure, because right now food is such an interesting thing. I will say that access to GLP-1s might be a little bit better for those who have insurance through their employers compared to any other group out there right now. I work with all aspects of insured and coverage. Manufacturers do still offer coupons for individuals. It can be very useful, can be not so useful. I will say that for like the brand Ozempic, it's $100 per month that they'll contribute, whereas Wegovy, they'll contribute $225 per month with this coupon. We have Manjaro, it's $150 a month, whereas Zepbound, same drug, still $150, but might have a little bit higher cost associated with it because different indications have seen different costs available. For those without insurance coverage of their medications, and this is still pretty limiting for the majority of individuals, one company will offer their product for $500 a month, period. You just send the prescription straight to the manufacturer and they ship the drug straight to the patient from the company. And it's $500 a month, which is markedly less than if you had to pay at a pharmacy out of pocket. It's markedly less than most pharmacies are able to get it in stock for. Another company, it's kind of an interesting thing. They offer it at a much discounted price where it's the lowest dose is $350 a month. And as the dose goes up, it goes to $500 a month if an individual fills it on time. Now, if a person is not getting their monthly fill and they're getting it like 50, 60 days, so every other month, then the price actually goes up. Instead of being $350 and $500 for the two different pricing ranges, it goes anywhere from $400 to $700, depending on how often you get it. It is still a company, and so they keep in mind and continuing these medications, it has some long-term benefits. So I can see both arguments there. So there are options available to individuals with or without coverage. Now, can most Americans afford a car payment and medication? I'm not certain that's true. And so that's a lot to think about in terms of these medications and whether they're truly affordable, even when made accessible in this way. And that becomes very, very tricky. I do know that there are some assistance programs available for those who do have, if they do have like diabetes is the indication. I know some of these medications have a much more accessible, where if your income level is below a certain price point or a certain amount per year, which is usually calculated by a percent of federal poverty level and takes into account your household size, then you can get medication free from the manufacturer. It's a semi-lengthy process to get it get enrollment going, but it's definitely something I've worked with some people in our clinic to achieve when they need this medication for their diabetes or for their chronic kidney disease, for that particular brand.
So there's a lot of legwork on the provider side, I think, to kind of make this accessible, but providers don't have a lot of time for that. So this is, it sounds like we need to build some capacity into our system.
Would be nice. I don't know that that's going to happen soon, but we'll see. I do think that this is something that can be made available to individuals, people who are motivated and are directed to find these applications. They're freely available online, and if they are willing to do the legwork, it can make it a whole lot easier, maybe 5 minutes of your doctor's time while you're already in the visit. So they do sometimes ask for a provider note to verify that this is in fact the disease state they have, but usually not in these particular indications, and they do just ask for the provider signature. And so I've had people walk into clinic where I didn't know that they're having accessibility issues, and cost was a problem for some of their medications, but they walk in and here's all the paperwork and they just needed us to sign it. So if an individual has that need, that's absolutely something that can be done, and making sure that your employees have access to that can be super important.
You've mentioned things related to health equity quite a bit. And I think that that is such a, it's a challenge, especially in a large company, to ensure that you have the same, accessibility for all employees, whether they're frontline or whether they're C-suite. My hope is that we, in the new world of workplace well-being going forward, that we're able to help drive some of that health equity within the workplace, because it has to happen. And I think your comment about having a dietitian really really stresses that. In this time where we're seeing workforce reductions, health insurance is really hard, and insurers and carriers are experiencing shortages and losses. And so they're cutting programs, which can include access to dietitians. But one thing that is starting to emerge is a lot of digital solutions, sort of these point solutions, value adds, where you could maybe have access to a dietitian through an app, or something like that. How do you feel about those solutions? Are they personalized enough? Do those providers, are they able to get all the information that they need in order to make recommendations?
I think, as with any medical system, information in is very important. So what comes in, junk in, junk out, I guess, for one way to say it. So if an individual is willing to contribute the information, like doing a food log, many people, that takes some work. That takes a lot of work to take an accurate food log. Like, oh, I ate, I need to remember to put that in there to send to the dietitian. Or I didn't record that I went for a walk and now I'm not, keeping up on this or that. And so I think it takes enabling an individual to be able to have the time to be able to submit these things. Perhaps they get a wellness break instead of their, part of their lunch, they get a little extra time to be able to log in and do these kinds of things, or meet with somebody, or being able to take that break. Much like a new mother who's lactating, other people need time to take care of themselves and wellness. For the 15 minutes can save a lot of time elsewhere, in terms of giving a person a break to make their health better can improve down the road and cause fewer interruptions later. So that could be useful. I do know that in COVID times, we had some interesting, we didn't have access to all the things we used to. We were in isolation, we couldn't do it. And there were many centers that started offering cardiac rehab as a telehealth option. And they had individual providers who would log in with these people who needed cardiac rehab, and they had the monitoring system sent to them from the facility. They could log in, have a conversation, go through the exercises with them while being monitored from that healthcare provider. I do know that that's something that one of the national cardiology organizations was just asking lawmakers to help make more accessible to more people. And I think that would help a lot of employers to help get access to those services for their employees. Because cardiac rehab and similar programs absolutely have improved individuals' ability to do their daily activities. It keeps them out of the hospital better. It's really, really helpful in a lot of aspects.
The idea of being able to do telemetry remotely is just, it's very exciting. When we kind of look back at the history of the cardiovascular medical system.
Yeah, absolutely.
Very, very cool options here. I have a couple more questions for you. And I am not scrolling correctly, everyone. Okay, here we go. So, I wanted to just kind of circle back and, given all of this information, we're talking about individual approaches to GLP-1 medications, where an individual and their provider work together. I love that you're talking about, these health equity pieces, such as providing time for folks to focus on their well-being. It's one thing to offer a fabulous benefit package, but you got to give people time to use it. And so, your idea of wellness breaks, or, coming up with a code for time where folks can get their primary care, their annual checkup, and they can do it on company time. I mean, these are lots of creative ways that we can make it work for folks. I just don't know that we're having those conversations, especially these days when we're dealing with so many other issues in the workplace. So given all of that, what are some of the most common misconceptions that you encounter about these medications, either from patients or providers?
A lot of people think it's easy. I will say the dropout rate was somewhat higher in these studies compared to placebo by fourfold. So there's definite side effects. It's not an easy class of medications to use, and there are options in being able to switch back and forth and change agents and not be locked in can be useful and help improve tolerability of medications. Keeping on it indefinitely might be something that's required. I do think that these medications with a suppressed appetite, it's even more important to make sure you're focusing on good nutrition. Not just any calories, but making sure you have whole grains, fresh fruits and vegetables, and things of that nature. I've definitely seen companies try to strive for this, where their cafeterias actually just only offer a healthier option, and they may cost a little bit more, but better food access, and not having just that cheeseburger, as opposed to maybe making salads available more often. I've worked with companies, and I work in one now, where we can have a salad once a month free on the company, just to kind of steer us away from maybe less responsible food choices. So that could be something that can help individuals on these medications so that they're still getting good nutrition, like high protein snacks. I've walked patients through the process of how do you make like roasted chickpeas. So I have chickpeas for a snack, as opposed to, maybe potato chips. You get a little protein in there and a little bit of fiber, just simple little things like that. Putting out cookbook ideas, having employees, like there's a connection there when you communicate with other employees fighting the same battles as you. And so maybe you create a situation where you compare healthy recipes, and everybody kicks in a different one every week or month or whatever, or maybe like allowing company employees to maybe have a healthy only potluck type of situation, those kinds of things to share this process. And there's definitely studies in the cardiology world that have changed entire communities' dietary plans. One in China, actually, they changed out the salt in every place in town. The restaurants, the grocery stores, people's homes, everywhere, and to change it to a salt alternative. And they saw a dramatic drop in cardiovascular disease and hypertension. There's other studies where they changed to a plant-based diet, and they had community connection events where they would learn how to cook a vegetarian meal for those who had never really thought about cooking vegetarian before. And they again had, by implementing more whole foods and plant-based foods where possible, they were able to decrease cardiovascular rates in those cities as well. And so it was a very fascinating set of population health, where if you encourage and normalize and make this okay and not a shameful thing to want to pay attention to your diet and pay attention to your health, that community engagement can really go a long ways.
Oh, I love that. You're reminding me, I work with a group here in Portland, and they do something that I absolutely adore. Well, first of all, they have a fabulous kitchen. So that's always nice when employees have a space where they can actually prepare and store their healthy foods. But this is a very diverse population. And so they'll have like a salsa contest where, once a month, folks will make salsa, and then everybody gets to try it with, a healthy baked tortilla chip or something, and vote on it, or a chili contest, or, all sorts of things. These do, these kinds of activities do a lot for employee morale and keeping folks in a cohesive team, but it also can have some lasting effects because, now I'm taking that healthy salsa recipe home and I'm trying it out there. And the idea, with groups that I've worked with who have had employee cookbooks where employees contribute and they kind of put that process together. I mean, they talk about it for years. It is just really, it's a wonderful, wonderful thing to incorporate into a work week. The other thing that I really appreciate that you said, and this is so important, and I'm a person who struggles with blood pressure issues, is the idea of, the table salt, changing out the salt. And so when I've used salt substitutes like the potassium kind of based salts, it's not quite the same. It's not quite the same. It's something you got to get used to. What if I mixed my salt substitute with table salt? And what if I did like a 50-50? Would that have much of an impact on my blood pressure?
Anytime we decrease sodium in a diet, you can have, and it's sodium specifically that has the bigger impact on cardiovascular health, you will see an improvement in blood pressure in populations. So, and some people have a higher susceptibility to that than others, where extreme salt restriction can be, and by extreme, less than 1,500 milligrams a day, can actually go almost as far at controlling blood pressure as some medication classes in those individuals who have a very high salt affinity for blood pressure. But it can, and I always encourage people, like, use all the other spices in your cabinet, like add some flavor, give it some pep, maybe use a little spice, maybe you use a little more cumin, maybe, pick a spice and get creative, because food can taste a whole lot better when you add in other spices and not just the salt. Yes, salt is a flavor booster, but so are so many other things. Maybe a little lemon juice instead of salt can have the same boost in some recipes. So
I love that. The idea of, brightening up a flavor profile with, lemon and acid, or hitting it with a fresh herb. And there's so many fun things to do. Just want to encourage and empower folks to experiment in the kitchen. You're not going to hurt anybody. Probably.
Hopefully not.
Probably. This is really helpful. I wanted to just check in with Avery. Avery, do we have any questions from our participants?
Not at the moment.
Okay. Well, I have more questions. So and we were talking, Dr. Dunn, yesterday that we could really go for a long time. So, so, thinking about GLP-1s and experiences and testimonials that I've read from folks, I want to go back to this disordered eating, because I think it's a really big risk. One thing that we know is that actually we see a big spike in perimenopausal women when it comes to eating disorders. We start to experience all sorts of changes that we can't 100% make sense of. And so, we might go to some dangerous activities to try and control our body mass. But what would you suggest? I mean, we've talked a little bit about counseling, kind of going alongside the GLP-1s, but, for folks that have limited access, or their insurance plan doesn't offer dietitian coverage, what kinds of things should an individual look out for if they're starting a GLP-1 and we're concerned about disordered eating?
Making sure that you use whole grains, high fiber, high protein, low fats, definitely low fats across the board. I know that it's sometimes easy to say this, but it's not always as easy to do. And just in general, those kinds of food choices for everybody can be super beneficial, regardless of your stage in life. I definitely think that as a woman approaching this myself, I look at something funny and it's there. Being aware of what you're putting in your mouth is hard sometimes. It's very difficult in many aspects, especially when you're busy, you're running from maybe one job to another, or you're running from one place at work to another, or in my case, one clinic room to another. So sometimes I'm eating at my desk and maybe I'm not eating the things I should. Definitely guilty here. I'm not preaching from a pedestal. I'm right here in the ranks with everybody else. So I think it's important to be mindful of those choices. Planning food ahead of time was one of the things I learned is most beneficial. So not waiting till the last minute to go grab food from somewhere, but actually planning my meals and packing them with me. It's more cost effective a lot of times, and I can choose what I have available to me. And, I plan a snack because I know sometimes in later in the day, I'm going to want something and I'm going to choose something that's a lot healthier when I have time to think about it in advance. It can be super helpful for any individual. And
Well,
with these medications, high fat foods make the symptoms worse. So people will naturally notice that, I had a high fat food after, they took my semaglutide, tirzepatide, liraglutide this morning. I feel trashy right now. It can happen. We see the same thing with certain other poor food choices, like really fizzy drinks, like sugary sodas can trigger symptoms worse too. Some individuals will notice that they're with slower stomach emptying, they're going to have more GERD symptoms with these medications. So, the gastric reflex, making sure you're avoiding those acidic foods that can be triggering of those other symptoms, and just being mindful of the foods that may or may not trigger side effects, but also may or may not be healthy.
Oh, that's very helpful to know. Is it all fats or just the unhealthy ones?
All fats can have some degree of triggering of these side effects, the nausea, the feeling bloated and gassy. All of those can be contributing. I always tell people to look for the unsaturated, polyunsaturated fats first. They're a lot harder to convert into fat stores and a lot harder to convert into cholesterol than the other saturated, transsaturated fats. And so if you give your body less building blocks for dysfunctionality, there's less potential there. So
that's helpful to know, folks. So reading those food labels, because most of those fats are indicated on those nutrition labels. It's really important. So this has been such a fabulous conversation, Dr. Dunn. I mean, I love that you've given us, you've sort of framed the individual experience, how important it is to check in with your provider regularly if you're on one of these routines. And if you're able to get dietitian support, that's optimal. But if not, you definitely need to make sure that you're checking with your provider regularly. I also really appreciate for employers, that your call out on the health equity piece, ensuring that everybody has access in a way that is within their own context. And so ensuring that folks know about the benefits available to them and know how to use them is really important.
Absolutely.
It really is the best well-being program is going to probably include a good, strong primary care provider relationship. And so certainly helping folks with that. And just for anybody who's on the line today, if you're having a hard time finding a provider, won't you reach out to me? I'd be very happy to help you. It's not easy, and it's certainly not easy in Oregon right now. So
no, nationwide.
Dr. Dunn, this has been wonderful. Thank you so much for your time. Thank you for all of the work that you do, not only for people like me, but for folks, everybody who's either experiencing or trying to prevent cardiovascular disease.
Yeah, absolutely. Thank you for having me.
Thank you. Take care. Well, next, I'd like to turn us over to Linda Spalding for our wellness break. Linda is first of all, Linda is not only a fitness professional and an expert, but she's also an expert in workplace well-being and safety. I've had the pleasure of working with Linda for years, and I'm very excited to turn this over to Linda Spalding for our first wellness break. Thank you, Linda.
Hi, everyone. How are you today? Everybody doing great? Thank you. That was such an incredible conversation. I learned so much, and I'm so glad we're addressing this topic. Well, you guys, we got a quick stretch break because let's get to the heart of the matter. And the heart of the matter is you guys. I think as fitness and health and wellness professionals, it's really hard for us to take time for ourselves. And I want to really keep ourselves at a top priority. So I put together, yes, it spells heart because it's the theme today, but I'd like to go through just a couple of stretches and feel free to make them yours. Listen to your body. Welcome to do seated or standing, clear the space, make this yours. And so I want to really start with H, head. And really it's this, is making that mind-body connection and making yourself a top priority. I think is really important, focusing on what's present, you being present, and mindfulness. And a couple of stretches you can do is just dropping the chin to the chest and just taking a couple deep breaths, dropping it to the head to the side, just kind of starting to loosen up a little bit, because we spend so much time, I say lock and loaded, maybe behind your workstation, tension. It's just good to kind of unlock this with some deep breaths to get started with, and getting that mind-body connection, starting that check-in. I think that's really important for us throughout the day, is to stay connected to our bodies, how we're doing. So head side to side and chin down. So getting nice deep breaths. Yes. Doesn't that feel great? So let's go, let's start spelling our wonderful word today. E is eagle pose. And really this really helps with shoulder flexibility and upper back. We sometimes have a lot of tension in our upper back and neck. So eagle pose is you can take either arm out in front at a 90-degree angle, scoop the other one under. You can place your hands together or hands here. And you just want to drop the shoulders down. And that really helps with the back, actually kind of helps strengthen the back. Eagle. And you can also add a small curve forward, just kind of opens things up a little bit. And again, and really helps with shoulder mobility. So this is a great stretch you can do. And we can change sides, transition, other side, bringing it down. Excellent. So bringing that straight down. And again, you're welcome to add that little bit of curve forward with that breathing for eagle. Fantastic, fantastic. Couple more breaths here. So we started with our head and we've gone to eagle and release, kind of shake things out. The next one for A is air squats. And I love squats. They're functional and they actually can improve our heart health. So you can start, if you're seated, you can stay seated. You can use your desk if you'd like to stand up. If you're standing, feet are shoulder width apart. You can even place your hands on your hips or on your desk, and you want to shift those hips back. A little bit lower. Shift those hips back a little bit and just sitting back. Yes. And this is really good for heart health. It helps with circulation. Also, it's super functional. We squat all the time. So I think it's really important to do a couple of these. Weight on the heels. Yes. Lots of versions of squats. And again, very functional. So really sitting back, it helps with strength, actually promotes posture too. So I love the A air squat. So air squats, fantastic. Couple more here. Good. All right, one more. And let's move on to our next stretch, rotation. Again, another functional stretch, which I love. We rotate all the time. So again, you can go side to side. This really helps with digestion too. And I'm kind of picking up my bottom foot too. You can stay stationary, but also you can pick up, if you're moving things around, if you're lifting, it's really important to take your hips with you when you lift. But I love rotation. Also reduces risk of injury. We rotate a lot in life. We don't have 90 degrees in our life, how we move. So I like rotation. Picking up your feet, really important. Good. You can make a dance routine out of it. Go heart association. I love rotation. And again, it's really, I like the digestion aspect of it too. So that's really important. And the last one, T, we're finishing the heart, is toe touches. And again, you can do this seated or standing, but toe touches helps reduce stress, enhance posture, opens up our back body. You're welcome just to bend forward and have your hands above your knees, but it really helps with just actually cardiovascular health, again, getting that circulation going throughout the day. So toe touches. And again, you don't have to go all the way down. You can go whatever is comfortable, but reaching forward also helps with spinal decompression. A lot of benefits to it. It's just if you're at your desk, bending forward, just kind of stretching things out is really beneficial. So you can go all the way down. I'm going to leave the screen and pop back up. But toe touches are really another one that you can do too. So again, I really appreciate you guys today. And you are the heart of the matter. And again, it's head, eagle, air squat, rotation, and toe touch. You guys are the best, and I hope and you can shake things out. And it's an honor to be here today, and I really appreciate you guys. So big inhale up for the Heart Association, shake things out, and let's get on with the summit. So you guys, thank you so much. I really appreciate you.
Wow, I feel great after that, Linda. Thank you so much. Isn't it fun how, something as simple as a rotation can really help to open things up? I think when I did the eagle pose, my spine just went all the way up. It was such a great release. So thank you for that. Moving on to our next section, I am so excited for this conversation. We're going to be talking about caregiving. And, our second panel here is going to address really how to support the sandwich generation in today's workforce. Sandwich generation are those folks who are taking care of their aging elders, and they're also taking care of perhaps children at home, or they could be taking care of, other folks. It's really about caregiving. And so we're going to explore those realities that are faced by employees who are simultaneously caring for their aging parents and they're raising their children while they're working full-time or part-time. These individuals often experience financial, emotional, and physical stress. And today we're going to discuss how workplaces can better support them through thoughtful structures and policies. Our first expert is Candace Smith. Candace is the Vice President of Strategic Initiatives at famtech.org, where she helps to accelerate solutions that improve family life, and the founder of Benefits to Care, which is supporting organizations in creating caregiver-friendly benefits. Her leadership and innovation have earned her several honors around the world. Candace is currently an advisor to multiple caregiver-focused startups and a board member of the Wellbeing Think Tank and the Oregon Jewish Community Foundation. We're also joined today by Dr. Dorinda Schubert. Dr. Schubert is a psychologist with professional experience counseling children and families, creating, managing, and evaluating programs in foster care, mental health, and developmental disabilities. Dr. Schubert is an intergenerational champion. She led the team that created the Bridge Meadows, and she advocates nationally for intergenerational solutions through thoughtful structures and policies. Welcome, both of you, and thank you for joining us.
Thank you.
I sure enjoyed our conversation yesterday, Candace, and so I would like to start with you. From your perspective, what are the most pressing challenges that sandwich generation employees are facing in balancing caregiving and their work responsibilities?
Well, let's first set the context. You sort of gave an overview, but some stats. I'm a stats person.
Yes.
Data drives a lot of decisions out there. So 53 million Americans are caregivers. 44% of them do not feel that they had a choice in taking on their caregiving responsibilities, which is important when it comes to the mental health of a caregiver. 54% of these caregivers are sandwiched. And so ultimately that results in 2 in 5 employees provide care to a minor child, and 1 in 5 are caring for another adult. So really, thinking about the makeup of your employee population. So the pressing challenges are time. Honestly and truly, it's time. My expertise is on adults caring for other adults. So a lot of the statistics that I'll share today are focused on that demographic. When I say time, caregivers spend 21 hours or more per week coordinating care, not actually doing the care, but calling, negotiating on the websites, researching care plans, backup care plans, actually performing these tasks. When you add up the 20 minutes here and the hour there, it accumulates to about 4.5 days per month in performing that care. And then I like to put the context of historically, and I know it's changing, but traditionally caregiving has fallen to women. The average woman or the average caregiver experience is 4.4 years, and a woman can expect to care for another adult 3 other adults during her lifetime. So we're talking 13 years of caregiving. So when I say it's time, I mean, it's really and truly important. You also touched on in the introduction financial aspects of caregiving. The average out-of-pocket spending of caregivers per year is $7,200. That's me paying for the prescription or the care because I don't want to deal with Medicare or being on mom's account. And that results in almost a third of your employees who are caregiving stop saving for their own retirement. 25% will take on more debt personally so that their loved one has the type of care that they want for them. And ultimately, about 5 million American caregivers report being unable to cover their own basic needs, food and shelter, because they're prioritizing the care of another adult or their family members. So, time and money. I hate that statistics bring us back to that. It doesn't even touch on the emotional side of caring for someone, and in most cases that has a limited lifespan. But I think those two are the most pressing challenges.
Candace, I think about our employees, our low income employees who likely have to live pretty far away from work. So on top of all of these other pressures, now they also have to build in, that hour-long commute twice a day. I mean, it's just really overwhelming. And I'm guessing a lot of these folks are working more than one job in some cases.
Dorinda, I don't know if you want to jump in. There is the misnomer that the average caregiver is an hourly worker. Statistically, that's not necessarily true. It spans all levels and I'll actually bring in some statistics later when we talk about the impact on the workplace of caregiving. So.
Yes, it's the entire economic strata. It's affecting all of us. Caregiving does not discriminate. I think if you have limited means, the burden is probably larger because you, like you said, Nicole, have to live further away. And this issue of time, it's also your time that you are spending to drive to the doctor appointment, to drive from your workplace and get there on time. And, just the stress and the role conflict. As Candace said, this issue of time scarcity, as a sandwich caregiver, you're worried about, okay, I got to get the kid to soccer today by such and such. And I got to contribute to snacks because I'm the snack mom today. And my elder has a doctor appointment and it's on the other side of town. And how do I do this? And you need a care team with you, but so many of us don't have that support or that intergenerational support because we live far from our extended family because of opportunities with our jobs and careers. So I want to just emphasize this issue of time is as big as losing money, and it is concerning that women are often the caregiver. Not to say that men can't be. Truly, that is not that. We have many examples in my own life where men are taking care, but women will take a step back. We saw this during the pandemic. So many women left the workforce to take care of their children or their elders. So women are at a great risk for being compromised in their retirement years because they lose time in the workforce and putting money in the bank.
Statistically, again, I'm going back to data.
Good job, Candace.
A woman who is mid to late career, so caregiving for an adult typically hits in your late 40s and your 50s, while you have, preteens and teens at home. But a woman who steps back from her career to be a primary caregiver is 80% more likely to live in poverty herself in her own old age, because you're in your peak earning years, you're in your peak Medicare savings years, retirement years, and it accumulates. I think that the statistic when I last looked at it was $350,000 in lost income at such a crucial time. And yet, as we started this conversation, people choose to take the step back because we're humans and we want to be caregivers and we want that luxury. Often you'll find that people leave the workforce in who are career women because they can afford to, or they think they can afford to. Whereas as we started, perhaps people who don't have financial resources are living working one or two jobs, they just fold it into their daily lives because there is no option of stepping back.
Yes, and we should overlay the cultural norms. So for some cultures, taking care of your elders is the expected thing to do. And so now you have that added stress where you have to take care of your little people, you've got to take care of your elders, you have to take care of yourself for the future, and this added stress of, but my culture says that I must take care of my elders and I'm not to depend on other people. So a lot of psychological distress that's hidden that our employees may not be expressing. And we see that there's an increase of depression and in sleep and insomnia problems, and low productivity then happens, and increased absenteeism happens, and then a fear of, am I going to lose my job? And it's all invisible and we can't see it. And so I think it is important that we as employers are attentive to what's going on for our caregivers. And it's more, not that it isn't stressful when you're only taking care of one generation as a caregiver, but it is multiply much more stressful when you are a sandwich generation. And so it's important that we as our employers are asking quietly and privately, asking our employees, how are you doing? When I know I have a colleague with a 3-year-old and a parent who's in the hospital, we're talking about what's that schedule going to look like? What deadlines can we move? Who can take on pieces of your work? How can we spread this out? What can your schedule be? I need you to be here between 11 and 2, but beyond that, it's asynchronous. So we really need to destigmatize caregiving, and we also need to acknowledge that it's a society issue. It's not a woman's problem.
Oh, wow. This is, well, we're going to have a good conversation here, my friends. So, I have to call out too, that this also is all happening, this sort of silent experience that folks are experiencing right along the same time that women are experiencing potentially silent heart disease. And, we experience heart disease differently. We experience the workforce differently. And so having, this kind of emotional drain can be really affect even a company's productivity. So my question, when you were talking about the cultural piece, is there, this sort of altruism, is there anything that is protective to our health and well-being when we have sort of this approach that we're taking care of, and we need to, I'm not saying this very well, but that we need to care for our elders?
Oh, yes, it's having this whole idea about social isolation, because that can happen when you are caregiving, right? You don't have time to see your friends. You don't have time to do your workouts. Thank you, Linda. That was awesome to do, by the way. And you really need to surround yourself with a team. And that could be professional people, that could be your neighbor, it could be your siblings, it could be your cousins, it could be your friends that you call family, it could be, and your employer becomes a part of that team by offering flexible work schedules, offering concierge services. Like, I mean, I can't tell you the amount of time, as Candace said earlier, the amount of time it takes to navigate our health system on behalf of your beloved elder. And now I'm speaking as a daughter and a psychologist. It is incredible. And I am fully capable of understanding these systems.
Yeah.
And I have to,
Go ahead, Candace.
just before I came on, I got an email, a marketing email from Amazon saying, sign up as a caregiver so that you can manage prescriptions. Kaiser recently has changed their entire patient portal experience where they ask you to add a caregiver of record.
Wow.
Now, of course, there's reasons why they are doing that, but it just proves to me that when big business starts recognizing the importance of having a caregiver or a care team, a circle of individuals that are participating in the care, it is normalizing what we have been talking about. Is trying to get out into the open that we are all caregivers. I think it's Rosalind Carter who talked about, at some point in our lives, we are all going to be caregivers, whether we give it, need it, or receive it. So I think that that's really important. One thing I think that is I'm passionate about, especially in this intergenerational cultural environment, is the burden that caregiving has on children. There's many children under the age of 18 that are the primary caregiver in their family during the day or night than there are people with Alzheimer's in America. And you don't realize that. But these children are coming home at age 10 to take over caring for an aging parent, grandparent, or family member. They're not participating in school activities because of things like that. And that's not really a Western hemisphere. It is a cultural thing, or a socioeconomic as well. But I think that that's really important to point out when we talk about sandwich generations.
I appreciate you talking about that because we are seeing that happen in our Bridge Meadows communities, that we are seeing young adult siblings now taking on the care of their younger siblings, from teenagers on to babies. And that will now be something we have to really talk loudly about, because what happens for those folks' economic situation, and what will be, how do they maintain their health and well-being while they're taking care of their siblings and their elders. So thank you, Candace, for raising that. We haven't talked about that yet. That's not out in the literature very much. So perhaps Candace and Dorinda need to write a paper about that. And
anytime.
I love that. And then we need to come back and have that conversation next year. Well, this is so.
When you think about the future of work, as we're talking about,
that's right. That's right.
The impacts are quite large and long.
Yes. Well, by the time 2030 hits, there will be more people over the age of 65 than under the age of 18, which will completely impact the workforce, no matter what industry we're talking about. But I want to share with you all that Oregon has already hit that mark.
Yeah.
Okay. That's very interesting. And yeah, that tracks actually, doesn't it? Let's say that I'm an employer, right? And I just hear you say that as an employer, I'm part of the care team, right? So how can you share with an employer the value, the impact that caregiving can have on mental health, productivity, and these longer term career trajectories without an employer feeling like they have to take on this liability?
I'm passionate about this whole topic. I spend a lot of time working with emerging businesses who are developing primarily tech solutions to support families. And often the way small companies get funded is you're scaring everybody. And by now, I love statistics. And so when we're pitching to an employer, did you get 25% of your employees who are caregivers have deteriorating mental health, which results in 8% higher healthcare costs, or the average caregiver for an adult forward and be an active member of the care team. But I almost liken that to 50s, a woman had to quit her job and she got pregnant because an employer didn't want to deal with all of the issues around that. We need to remind our employers the absolute value of having employees who are caregivers and to work with them during that 4+ year. Caregivers are phenomenal at conflict resolution. They are phenomenal at, pulling money out of thin air. They're phenomenal at, getting something that should take 3 hours done in 20 minutes because they can focus. And not to always emphasize the financial loss, productivity, and presenteeism impact, but really have that as the catalyst for stepping forward and being part of an employee's caregiving circle of support, rather than a reason to not further invest in them. One of the questions coming up is, the impact on people's careers, and we can talk stats about that. It is so important that employers have this idea of managing, helping individuals manage through all of life's experiences, and being there for them. So,
And it doesn't take a lot. I think that's the other thing to reassure employers. It doesn't take a lot for the employee to feel cared for and seen and helped. So a little bit of flexibility of time off, paid leave for elder care as well as child care. And other ideas are the FSA program that includes care in it for elders. It doesn't take a lot. And really having a culture of we care about our employees and we care about their families, that in itself brings great peace to an employee. So then that employee they're not using any brain power or anxiety about worrying about their job. And we could take that away as employers. Then they know we care about you. We know you're going to get your job done. You are a valued employee, as Candace said. They have all these incredible skill sets. I would also say multitasking and figuring out complex solutions or complex systems to create an easy solution. Critical thinking, we need all these. So what we need employers to understand is it's not like you have to provide this huge package of incentives or benefits. It's just a little bit.
And it may not even cost much.
Yes.
Of course, I brought a company to market that was distributed as an employee benefit, sold to my company to a carrier that now distributes it as an employee benefit. And going through that whole experience, I'm like, wait a minute. If an employer offers health insurance, if an employer has some type of retirement or financial support for their employees, if they have leave policy, if they have an EAP, they have already everything a caregiver could need and want in their existing benefits package. They don't need to buy a product like caregiving.
That's right.
You don't need an additional point solution. What you need is a one-pager or that says, okay, you have Blue Cross Blue Shield of Oregon or Providence, they're a sponsor. And here are their links to caregiver benefits. And here's how you could use them. If you've got Fidelity, here is Fidelity's caregiver support program. Just connect the dots. As Dorinda was saying, when you don't know what you don't know, and you further don't know when you're in a crisis because someone you love is unwell, and you're trying to navigate a complex system. But if there was just a quick sheet that said, hey, we see you, the 20% of our employees are also just like you may not know it. And here's how what we offer today can help you. Oh my gosh, if somebody would have handed that to me,
Mhm.
I would have said,
Yeah.
oh, okay, that little bit of peace of mind,
Yeah.
then it opens the door to have better communication with the employers.
I think you're absolutely right. And it really is, so many groups have these group health plans. They have so many point solutions and other solutions that are already embedded and people don't even know about it. And so really educating, especially those mid-level managers, and giving them the time that they need to share that information out. And then go ahead and stick that one pager right on the bathroom stall.
Exactly. Exactly, Nicole. The Milken Institute last year did a research study about what do employees need? What would a sandwiched caregivers need? And one of the top things they talked about needing is this very thing Candace is talking about, is a place where I know where I can go for help. And that and where I can go talk to the HR department and say, okay, so if I do this, I'll do that. If I do this, it will take me to there. Just
Yeah.
having that reduces the stress
Totally.
so much, and you now are a part of the care team because you supported that caregiver.
I love this. And I love this especially because in Oregon, like so many other states, 80% of our businesses are small businesses or closely held family businesses with very little capacity. We're talking maybe an HR of one if you're lucky.
Yeah.
Right. And so the dissemination of that information can be tricky. So this roadmap that you're giving us right now, what do we need to look for? How can we communicate this to our employees? And then how do we support them as they, access the programs? I mean, it was spot on. And so, Dorinda, you're really an expert on ways to create flexible solutions. So how can things like flexible scheduling and remote work options or even paid family leave, how could things like FMLA or Oregon's OFLA, how can we use those resources and tools to support the needs of the sandwich generation?
Well, definitely making them known to our employees, and having a conversation about here's how you're going to access them, and having that conversation when it's not a crisis, because when it's a crisis, we're not going to remember. And also, you might have that conversation when they start work. There's a lot to remember when you start work. So maybe like in a month, check back in and go over those benefits. Maybe quarterly, have a little, lunch and learn, so that people can just spoon feeding it to them that this is what's available to you. Here's how you access it, because one and done is not going to do it.
Absolutely.
And I love your idea about having it in the bathroom stall. You're just constantly having to pour it into people in a natural way. Have it on the refrigerator, in the kitchen at work. Have it by the coffee maker or the water, the quintessential water cooler. But it's constantly explaining to your team that this is how we see you, we believe in you, and you're also then, by doing that, you're sharing with them that you have a culture of supporting caregivers when it's being watered all the time. It's like watering a plant,
I love
So
that.
my counsel would be keep it visible, keep the conversation alive, and as many wonderful HR folks do, is your door is always open. No question is a dumb question. We're here for you. And then when they do have a crisis, because we never know when our dear elder will have a stroke. I personally just had this happen on Saturday night while I was hosting a party for 15 people. And so you never know when that's going to happen. But thankfully, I knew who to call. I knew who could help me. I had my team to help my dear beloved aunt. So I can't emphasize it enough. Just talk about it, have it available, and make it normal.
And if I could add on to that, again, the stats, 9 in 10 managers believe they create an environment where employees are comfortable communicating personal challenges, which a personal challenge is, my mom, whatever the issue is, right? It's something personal. Only 64% of employees agree. And so while we keep saying, oh, just have an open door in HR,
Yeah, no.
there's so much of a taboo around this topic.
Right.
You don't want to be the daughter who can't take care of the mother and her own children. I know that firsthand. You don't want to be the one to admit that you're so depleted, but you don't have any leave days that you can take for yourself to replenish. So I encourage offering alternative ways for employees to communicate their needs rather than scheduling with HR or, saying to their supervisor, well, I'm a caregiver too, or I need to leave, in one of these crisis situations. So somehow, some way, if it's anonymous questions that then get answered in a company newsletter
Yes.
or at a session. I think it's also incredibly, incredibly important to normalize the term caregiver. I never self-identified as a caregiver. A caregiver was Nurse Cratchit, right? Like,
Right.
I didn't need to cut my dad's toenails. He could do that himself. And I was offended at the concept of being a caregiver. So most people still don't self-identify in that role. They're simply daughters or nieces or nephews or sons. So contextualizing what caregiving is, saying, you're a caregiver if you pay out of pocket for something for your parents. That makes you a financial caregiver. You are an emotional caregiver if you, spend 15 minutes with your aunts on the phone each week. It doesn't necessarily have to be this connotation of mom lives with me and I'm worried she's going to leave the stove on. I think it's really important if and when somebody does say, I have these caregiving responsibilities, that you educate them on FRD, Family Responsibilities Discrimination Act, saying you are protected. We cannot discriminate against you. You're not going to get fired or be asked to choose between attending a meeting and attending dad's chemo. There are legal supports for you. Take that off the table. And also, I encourage you to track caregiving status, understand the trends and the demographics. Caregiving impacts everybody, as we talked about, but it impacts industries in varying ways. I mean, think about a financial services company who at tax year end is just, your accountants are working 80 hours a week. Well, kids still need to get to school. And parents still need to get to appointments. So putting in maybe possibly additional supports, mental or health breaks during these peak times of your organization's life cycle is yet another way of helping people self-identify and then get the support that they need.
I love your suggestion about tracking. I mean, I think that this is something that, I'm not seeing being done in most places. And I mean, that is just a really great suggestion.
Well, and the result is, because you're not tracking, 86% of all family leave benefits go towards the 40% of employees who have children. And so another thing that employers can do is, when you know the demographics of your employee base, equalize out. Oh, wait, we are a law firm and we have more employees who are in their 40s, 50s, and 60s who are likely caring for or becoming care recipients themselves than we do parents of young children. Perhaps we need to equalize our benefits and put more into later stage caregiving solutions and opportunities than caring for minor children.
Wow, that you two have blown my mind today. This has been absolutely wonderful, and I wish we had more time. I do think this is worth scheduling another webinar for, to kind of really zero in on some of this, because I know you have some really great detailed solutions that I think our groups would love to hear more about. Are there any, speaking of solutions, our health plans, for especially for self-insured, are they able to do some of that legwork, some of that tracking for an employer that may not have the capacity?
You mean the statistics tracking?
Yes. Yeah.
I don't have my fingers on it, but there is a national nonprofit that allows you to track through them. So you create your own sort of instance, and people, you can survey or encourage your employees to go there so that they are self-identifying to a party, and then you get your data rather than a lot of times in these small businesses, you know who the caregiver is, but it's such a taboo topic. You don't want to say, so, hey, is your dad doing okay? I overheard your phone call. I would do that though, because that's just who I am. So
We do that.
I can give you in a follow-up the name of that national organization. There's actually the National Coalition of Aging that has resources too that help employers sort of put out materials and quasi survey without self-identification as well.
This is so incredibly valuable because, you know, care solutions, you know, whether it's, you know, a home, a nursing home, a group home, or a facility, are very, very, very expensive and cost prohibitive for most retirees even. So you know, an elder funding their own care is oftentimes not possible. So it's essential that we give this the time and the energy that it deserves to find solutions, especially as you are sharing with us these really powerful statistics showing that this is only going to be a bigger issue in the coming years. Thank you both so much for your thoughtful insights. You know, supporting the sandwich generation, it's not just a benefit, it's a necessity if you want to have a sustainable and an inclusive workforce. So now we're going to transition to our next wellness break.
Hi everyone, my name is Nicole DeRobbie. I'm a local nutritionist here in the Portland area, and today I'm going to show you one of my favorite effortless recipes. Now, the reason why I call most of my recipes effortless is because they're fast, they're super simple, and this one in particular doesn't require any cooking, which I think all of us will appreciate. We're all really busy, and I'm sure you'll agree with me on that. And when life feels like it's nonstop, we assume that healthy eating has to feel complicated, and it really doesn't. So I've got a few ingredients here. These are very simple, and I want to show you how quickly you can pull together a meal that's satisfying, it's nourishing, and most importantly, it's going to fit into your everyday life, because that is what we need. We need simple and doable. All right, let's talk about some ingredients. I've got some low sodium tuna, some canned garbanzo beans, and this olive tapenade, which is one of my favorites, lemon, cucumber, celery, oregano, bell peppers, and olive oil. Simple ingredients that you can pull together in just minutes. You'll see this container again later, so stick around. We're going to talk about why I always prep extras. But first, we're going to start here because I want to talk about meal prep. Having a few things chopped and ready makes all the difference, I'm telling you. So these peppers won't just go in today's recipe. You can use them all week in wraps, salads, or just as a snack. I like to call this the chop and plop method because you're doing it once and then future you is all set. Next up, give those beans a good rinse because it helps cut sodium and makes them taste fresher. So I've drained and rinsed the beans, and I've also drained the tuna, and now my cat is staring at me wanting some. I'm just gonna break it up with my fork. What I'm doing is I'm actually going to make a batch prep of this. This is where meal prep comes in. Because for me, if I'm spending time in the kitchen, I'm not gonna just make one meal, I'm actually gonna make multiple meals. If you want to, you can use more cans of tuna than just one. It really just depends on your dietary needs. The garbanzo beans are gonna go in. Then from there, we're going to be adding in all these amazing vegetables and adding flavor to this. First up, celery and cucumbers. So you can also chop these ahead, put them in a container, and then adding veggies to your meal isn't this big production. That's the beauty of meal prep. It's not about cooking full recipes in advance. It's about having the parts ready so you can throw meals together without stress. Now we add those beautiful bright bell peppers we chopped earlier and a squeeze of lemon for brightness. And yes, I use a lemon squeezer because honestly, if you don't have one, what are you even doing with your life? And here's my favorite shortcut. This olive tapenade is from Trader Joe's and it's my secret weapon. Scoop it in and you've got instant Mediterranean flavor without chopping a single olive. And then just finish with oregano and a drizzle of olive oil. I'm adding a little bit more salt and we're gonna mix it up, and now you can see how easy it is to create multiple meals in probably under 5 minutes. You've got your protein, your fiber, healthy carbs, lots of vitamins and minerals from the veggies, and lots of color. The last thing that I want to show you is for all of you who are working in the office for very long hours is this little container. Take from the main prep and add it into a container, and then you can travel with it to work. It's pretty simple. And there it is. The final bowl is really colorful, fresh, and ready to eat. I hope this showed you how a little prep and simple ingredients can make meals you'll look forward to.
All right, welcome back everyone for our third session. We're going to discuss functional and policy-based opportunities to navigate the change. So as the national climate continues to shift, many organizations are facing budget constraints, operational changes, and all of these are going to impact their wellness offerings. But despite these challenges, employers can remain committed to supporting their workforce. So today we're going to explore how we can adapt, innovate, and remain flexible in the face of change. So first, I'd like to introduce Dr. Ryan Baugus. He received his doctorate degree in physical therapy from George Fox University in 2015. He has a passion for promoting a narrative of resilience and empowerment rather than reliance on the traditional medical model. So Ryan utilizes a wide range of treatment approaches to improve an individual's ability to manage injuries and variability of sport and life. He's not a believer in magic hands, and he's very upfront with his patients about the limited role that a therapist's hands play in their overall wellness. He believes a true motor learning occurs through the organic process of movement experience and error correction. And Dee Dee Montgomery is a sixth-generation Oregonian, a published author, a blogger, and a certified industrial hygienist and safety and health professional. Dee Dee has 40 years of professional work experience, and while she's mostly retired, she still volunteers as a mentor and as the board president position of the Oregon Young Employee Safety Coalition. Dee Dee is passionate about integrating well-being into work and making work safer and better for everyone. Thank you, Dee Dee and Ryan, for being with us today. We're excited to talk to you a little bit about the future that we can expect to see. You know, Ryan, what are some of the biggest changes that you've seen in workplace health and safety programs over the year? You've had the sort of benefit of being almost embedded within a variety of industries. And so I think you have a pretty broad perspective on what we can see.
Yeah, thank you so much, Nicole and Dee Dee. It's an honor to speak with you as well. And I consider, you know, I'm a physical therapist, right? So you might be wondering, what does a physical therapist have to do with workplace wellness? But in 2018, my company, Headquarters Physical Therapy, made kind of like a full court press into workplace wellness. And one of the reasons for that, it was a big passion project of mine to think about, you know, access and think about, you know, the challenges that people may have, and you know, even just coming to a physical therapy clinic and connecting with a physical therapist. So how can we bring that, you know, to the individuals in their place of work? Candace and Dorinda just wanted to echo, you know, they spoke about the challenges being a caregiver, and people are so focused on taking care of other people that sometimes, you know, taking care of yourself becomes a third, fourth, fifth priority, you know? And so with all that being said, we started in 2018 and right as COVID came around. So we started with a lot of in-person, big whole-scale implementations for companies that encompassed everything from autonomic nervous system and stress management to nutrition to movement and exercise, and a lot of in-person. And that all kind of went away rapidly in 2020. So a big shift to more virtual solutions, which was a totally new world for us. Also a shift, and just as has been mentioned in budgets, changing budgets, maybe less or more resistance to invest in various things across companies, including, workplace wellness, has led to the need for creative solutions. And we've seen a shift from less maybe whole scale implementation to more one-on-one individual, the individual folks that make up a workplace, and how can we, meet their needs on an individual level. So those are some of the big changes.
Well, that is so interesting. I love the way that you were able to pivot. And it sounds like you pivoted well. Didi, you have expertise in this area. I was thinking of you in our last conversation, especially because, the impact that caregiving can have on an organization is pretty big, but the opportunity for organizations to support employees can be a pretty light lift. Can you share a little bit about the changes that you've seen in health and safety over the past year?
Yeah, and maybe even more than the past year, but really, I try really hard right now not to be negative. And some of you who know me know I can cry really easily. And I'm not going to do that, but well, I might. But the point being, I've for 40 years really been passionate about helping people be safe at work. And for the last 15, I got very involved in this total worker health movement, which is about integrating safety and health with well-being. I got involved in doing a large gaps analysis for a healthcare organization. I had many years at OHSU working with stakeholders. That's a summary of all that. But what I keep coming back to now, and I've been beating this drum, is people have to feel safe. And what I mean, if we think about not just workplace violence, but we think about so much right now, the last topic was incredibly powerful. As you mentioned, I'm an author, and I did write this book, which is, I guess you can't really see it, but it's called From First Breath to Last, a story about love, womanhood, and aging. And in there, I specifically say thank you to the elder advisor through my EAP that I didn't know existed, except on a wonderful day, OHSU during the pandemic sent out a reminder about resources, who helped me make the decision to move my mom at home. And I knew about family leave. I'm informed about a lot of those things. So, there are things out there. Even Ryan, thank you for what you said, because there are cuts. But I do think we were moving into a place of too much overlap, where there were resources here and here, and, our department might have access to this or that. And yes, it was waste, but it also wasn't increasing our utilization.
That's right.
So I'm kind of talking circles, but I think what we need to come back to is, what do people really need right now? And what can we do? And unfortunately, I believe some of those basics that people need is good paying jobs, benefits, safe work, not too many hours. And I literally, I didn't ask for this. I'm reading you a text, and I have to tell you where I'm coming from is my two 30-something-year-old daughters work in mental health and healthcare, one in an ICU, okay? And this is what one of them, the healthcare worker, texted me this morning. I was just talking with one of the nurses I work with about how badly his mental health is. And another nurse said that she feels fully drained each time she comes off a work shift. And that's such a mutual feeling amongst all of us. And when I asked, can I share that without names, she said, yeah, of course. And you can add that everyone in the room agreed. And this is something we talk about frequently. At the end of the venting, whoever's talking always goes, but I'm fine, which is always something I always say, because we have to be fine. So that's healthcare. So what can we do about that? I know we're going to get to some specific maybe solutions, Nicole, and I won't go there right now. But in that big picture, we have to address our workers, many in healthcare, many in tech, many in education, everyone in mental health and social services. people in corrections. This is how they're feeling. And there's not more staffing. There's cuts. And then on top of that, we have our coworkers or our friends in construction and manufacturing who are worried about their jobs. They're worried about new work. And so I promise I'm not going to be so negative throughout this, but
I think this is reality
right now.
Yeah.
And so if you said to somebody feeling that way, oh, by the way, when you have time, here's this or that. All these things, Linda's amazing. We're talking about, nutrition and exercise. It's all important. But what I circle back to is the privilege I've had of publishing 4 books while working full time, because I had something left when I went home. And I had a passion, and I've told people, writing has been the most important well-being thing for me in this last decade. But we have to think about how can we help people find that. And I don't have a lot of solutions there, but it's important.
I think what you both are kind of referring to sounds like burnout to me. And burnout is something that, most of us will experience in our careers. But that doesn't mean it's not very, very significant. And sometimes it can take people all the way to a very, very dark place. Christina Maslach, who's sort of the leading researcher around burnout, talks about compassion actually is the solution. That in her research, it's that acts of compassion can help to prevent burnout whether you are experiencing the compassion, whether you're giving the compassion, or whether you're witnessing it in some other place. Ryan, what I love is that you're doing that one-on-one with individuals, and that's huge. It's so important. Your work isn't just about getting fit. Your work is really about having compassion for your body and your experience. Can you share a little bit more about some of the results that you've seen?
Yeah, it is honestly, Nicole, it's an honor. Dee Dee, I feel everything that you mentioned. And it is it can be very sad and depressing, because many times with us and our team being so boots on the ground with folks, we are very much, on site at these companies, manufacturing, law enforcement, construction, even like we work with a great realtor group, there's these people. And we're working on solutions with these people and things that they can do from believe it or not, Nicole, we actually have a great anti-burnout specialist who's just finishing up her PT, who's become a really big part of our program because it's been so heavily identified, right? And I guess this is just a moment to even just say that when we're thinking about how we can positively impact people, a huge part of that is getting to know them. And I know I'm jumping around, question wise a little bit here.
No, we all are.
but getting to know them is so incredibly important. And you think about even just creating a product from a business standpoint, right? When you create a product, you look for signals from the consumer, the end user. They will tell you if you can sit down and ask the questions and get to know them, and you find those signals for what sort of products to create. And that anti-burnout piece is a direct result of just trying to put together, in our little HQPT corner of the world, when we're meeting with people in person or virtually or whatever it is, what's something we can do to try and make a positive impact there, Dee Dee. And once again, you're like, oh, the problem is so systemic. What can we do? But the looking for those signals in people and addressing, just where they're at in the moment. I think if you can do that on an individual level, and that can kind of spread out to an organization or department or organizational level, that's kind of where we start, is just boots on the ground. To answer your question specifically, Nicole, Some of the results that we've seen, one of the biggest, and this might be a little up in the clouds, but self-efficacy. I think some people are not used to being validated and heard and have somebody in their corner to help them. And yes, we absolutely, we prescribe exercises when we have 2 different on-site clinics where we have, satellite offices set up at businesses, and people come in and we put them on the table, the treatment table, and we do physical therapy. But it's so interesting how, someone may come in and say, my shoulder hurts, right? And they might have a few visits with us and their shoulder feels better, but now they're interested in sleep. You know what I mean? And we're like, oh, okay. So they start to build this self-efficacy to where like, hey, I saw this one little improvement in this one area. Now I can do this without pain. Maybe I can improve my sleep or my nutrition, or, hey, Ryan or Ashley or Dan or whoever's in the clinic, mentioned something about stress management, and I could really use some of that, so let's do some breath work. So once again, that's the self-efficacy piece is one of my favorite results, to see people start to believe, that they can have more agency and kind of change in whatever way is important to them.
That's really powerful. I'll tell you, I've shifted over the past 20 years. I used to think that those individual interactions are the most powerful. And I think they might be, actually. But how do you scale it, right? So then I kind of changed my mind and decided, well, it is systemic, and it's, we'd have to have these organizational approaches, and that's the way to go. But now, as I think I've matured in my career, I'm seeing that it really needs to be both, right? So Dee,
Yeah.
tell us a little bit about how we scale that and how we do this.
I love this conversation. Ryan, I love what you just shared. And I think that we all need to be seen and heard, especially in today's world. We talk about the loneliness that people feel, everything that's going on kind of out in the noise. And so I think that's, compassion is one of the most important things that we can give. And then I'm being heard and seen. And then when I feel better about my health, there's no doubt. I mean, just physical pain alone can draw all of us down. So thank you for that. I think then it's making me, I don't know if we have anyone from OHSU, but it takes me back to the healthy team, healthy you approach.
Yeah.
It was decades ago. And some of it fell by the wayside, but and a lot of the work at the Institute at OHSU that shows the power of the team and the power of a champion who is not a seen leader. We've all seen this, somebody who has just found whatever it is, their personal health journey. I mean, Linda is incredible. She's on the extreme side of that, and I love that. But just, so many people have found something. You talk to anyone who had apnea and they're using, they found solutions. They're the first to share it. So finding those champions. But Nicole, I think I go back and forth on what you just brought up. I still believe to make big change that's sustainable, you have to have the C-suite. I believe that more than I ever. It doesn't mean we can't do anything. The teams, all of that piece around micro practices to promote psychological safety. There's some great articles on that.
Can you just describe real quick, sorry, Dee, a micro practice? Can you define that for us?
Let's say we have no budget. We have our team meetings, we have our work that needs to be done. But that doesn't mean we can't have our team agreements. We give thanks and recognize people for their contributions. We help people save face when something goes wrong. We don't call them out in front of a group. We listen and focus on understanding and learning. We ask for feedback, and we want to accept it, even if it's oppositional to what we assert. And we ask for respect in these conversations. This is not saying, and so I think those are the kinds of things I'm talking about that develop this psychological safety that really underlines almost everything in the workplace. So I think all that's really important. And I was just warned by someone, which I never thought about, the risk when you have really strong teams is that the organization can continue on not giving the supports that maybe they could do because that team is thriving. So I think, I think we have to be wary of that. But at this moment, I think we are looking for these things. So, that's one, right? Really, how do we develop a good team? And as Dr. Leslie Hammer and others at OHSU have shared, the supervisor, right? All of us have left a job. I know I have because of a supervisor. And so what can we do to help our supervisors understand how to be a better supervisor?
Yeah.
Some people are born that way, many are not. And that is going to strengthen everything, even back to the previous conversation where there's been research showing when your supervisors understand benefits, understand confidentiality, understand the good work that is happening, Ryan's work, all of that, then they can share that in a safe and confidential manner. So the supervisors are critical. And then I would continue to say, looking for ways, and it's so hard right now in certain industries, but looking for ways to integrate. It doesn't mean a whole new committee, but maybe your safety folks and your wellness folks and your folks determining schedules. Can they once in a while have a conversation on a shared concern and choose one action item, choose one priority, not do it all? So I'm kind of jumping around too, Ryan. That's
No, but you're exactly
like
right though. And I think it is. I mean, it is those, I love that micro practice. That's a great word. Thank you for that one. But I do love the way that you're talking about supporting supervisors.
And I think the last thing I would say on that, there are some very known, I mean, we all suffer from stress, and a certain amount of stress is good. It gets us out of bed in the morning. But other stress, puts us down this difficult place. And I think there are some very well-known, but not always utilized practices to reduce stress. Certainly eating healthy, exercise, but internally around our organizations, things like I have several listed here, not to go too far, but how can I have more control over my job?
That's it. Yeah.
You and your supervisor could come up with that.
Yeah.
Is there something out there that you're really good at, that's your strength, that we need done, that you haven't been asked to do? And then just really encouraging people to care for each other, that's big. But I think the last thing I would say on that is regarding stress is a lot of people don't recognize so many people are unclear of their job expectations.
Other duties as assigned. I think that's what it's called.
If we don't know if I'm your supervisor and I don't know what you're supposed to do, let's have a chat about it.
Yes,
right?
absolutely.
And let me be part of the crafting of it. And these are things that take time, but then they kind of don't take time because they prevent wasted time. So there's a lot of these things that I think don't cost money that we can do now, but we have to be very thoughtful about building it into our systems.
Well, Dee Dee, you remember when Dr. Casey Chosewood from NIOSH said, your supervisor is going to have a bigger impact on your well-being than your primary care doctor. That's why we need people like Ryan too, right? To be able to screen for that.
I would just say, echoing Dee Dee once again, is that the programs that we've seen the most success in, the highest ROI, like the highest utilization, are absolutely where supervisors are actively engaged in the workplace wellness programs. With that being said, it even goes beyond just like giving the thumbs up to go see HQPT in the clinic or go to the seminar. When the supervisors themselves are actively participating and setting the example, that is where we see these programs just flourish.
permission for everybody else to participate. And we're really looking to our supervisors to give us that permission. It's just the way that our culture of work is.
Yep.
I love that. Interesting. Ryan, I know you're working a lot with, some pretty hardcore field-based industries like construction and law enforcement and even manufacturing. So, in these dynamics in some of these workplaces, folks might be a little bit more reluctant to advocate for themselves and their well-being. So how are you able to build trust and connection with those employees who may be skeptical of health initiatives?
I'm going to use a often quoted phrase here, but people don't know how much, or don't care how much you know until they know how much you care.
Mm-hmm.
And I've just found that to be very true in those culture heavy industries. You kind of mentioned much of my background is in sports medicine and, working with athletes. And it's funny because every sport has its own little individual culture and nuances and structure to seasons and in season and off season, you name it. And in reality, a lot of these organizations and even specific departments within the organizations are very much the same. They have their own culture. They have their own language. They have their own job tasks. And so with that being said, once again, I'm just kind of sharing impactful things that we've done, but going out and doing, we call them like departmental on-site visits, right? Where me and, some of the team members at HQPT will go out. And in manufacturing, for example, watch people put together little pieces with their hands and hold these tools and staple upholstery. And it's so fun because we get to go out and ask questions and get to know them and take, genuine interest in what they're doing. And it's so funny that, oftentimes employees will be like, you try it. You see how hard this is to do, and then imagine doing that for an extended period of time. And so we get real hands-on with people. The same thing, and I'll just add one more point to that is, we've done a lot of work with the Portland Police Bureau over the years. And I don't know anything about being a police officer, right? The same way that, a cricket player might walk into our PT clinic and I don't know anything about cricket, so how do I get to know? I ask questions and I'm very honest about not knowing, and over time you get to learn more and more and more. And then just like I alluded to before, the product gets better because you're listening for those signals that cultural and very, granular in terms of work duties.
Do you think, Ryan, that would be different because I'm thinking about the scale of what you do, so you can get one-on-one with folks. What if your team was, 150 people going out and serving different groups? How are you scaling that and able to keep the compassion piece steady?
Are you saying the teams that we're visiting is 150 people?
No, if your team was 150 people and you were all going out to different environments. And the reason that I'm asking this question is because I think, it almost is analogous to a supervisor experience, right? So the way that you're able to scale and be consistent in your practice, I think some of those tips could be helpful to supervisors and top level leaders as they're thinking about how to manage these programs without spending a ton of money.
No, it's a great question. I think part of how we maintain the quality of what's happening out on site with these companies that we're very honored to work with is that we meet as a team and we talk about it. And Megan Carlson is on this call. She's our workplace wellness director, and she's in communication with the companies that we're working with. And she's constantly listening for those signals. And then internally we're meeting on, hey, what's the real goal here with these folks? And I think that's scalable. If you Well, it kind of goes back to what we just spoke about, is the top down, right? I enjoy being out with these great folks at the companies that we get to work with, and bringing other team members along for that journey, and just kind of showing the standard in terms of how we interact with the folks that we get to work with. I would say that, yeah, that's probably scalable out to a team of 150. I don't know that I'm ready for 150 employees, but I don't know. We'll see someday.
Well, get ready. It's going to be popular. That's really very, very interesting. I really appreciate the way that you're sharing that, because I think, scaling compassion really is about shared values, isn't it? And so it sounds like you're selecting and training and growing your team in a way where you're all very united with the values of, supporting individuals, advocating for their well-being, and really kind of letting folks, it's the self-efficacy piece, which I think is so brilliant. I haven't heard that before, by the way. That's great.
Thank you.
Dee Dee, you and I have had a lot of conversations about, metrics and how people, kind of figure out what their employees want. The most popular tool is probably surveys, right? And I know we love to talk about surveys, and we love to design surveys. And you've had some very, very deep experience in this area. So you've done both qualitative research and, sort of more numbers based. But how do surveys and gathering employee feedback help you gain or lose trust from that employee base?
Yeah, thanks, Nicole. And I am not a survey expert, just to make this very clear. But I do have some strong opinions based on my experiences. And so I do think surveys are really important. They can be, but I think they can be overused. And I think the biggest risk that I've seen, particularly in large organizations that are particularly challenged, is asking for things without a plan or an ability to transparently share what comes out, and maybe even more important, to take actions based on your finding. So I've seen that, and I won't talk about specific examples, but I've had confidential interviews with many employees in a certain kind of project, and I think that's among the worst things you can do, especially if you already have a disconnect between what your employees feel about any level of management. So that being said, I'm not a survey expert, but what I would want to know is, what do we really want to ask? What might we do with it? How will we share? How will we allow transparency and conversation around what we find? And if we get this answer, what are we going to do with it? I really, honestly, I think I know surveys are important for certain things, but I think, Ryan, I love everything you said about kind of the one-on-one and, feeling safe. And there's an awful lot a good supervisor knows about how their teams are doing. They know about what's happening in the work. They know the quality of work. They know the pressures. And I would just as importantly really want to look at what's happening within each team. And I think what's unfortunately not often understood, even with people who work in benefits or in HR, is how different jobs are, how different, the stressors and the job things are, I mean, the different demands and what we do every day. And so, I'm kind of going off topic here a little bit, Nicole, but I do think that I do think we need to be smart about our surveys. And, I remember at OHSU, this is funny, years ago, this is probably 10 years ago, when we were moving into this whole idea of kind of looking at total worker health. And folks from HR did this wonderful thing where I don't think it exists anymore, but on the website, they listed every benefit. They did a survey of every benefit you know, and every opportunity tied to wellness. And it was amazing. It was a little overwhelming. But the point was they did look at that to say, oh my gosh, like we have this stuff people didn't know about. And then there was going to be a survey around that, but there were already too many surveys going on. So I think this is where you have to, if you're in what, you know, we can't be compartmentalized within our organization. It goes back to that wanting to integrate. So if our HR team wants to do a survey on this, then what other surveys have happened? Because we cannot over survey our population.
Oh,
So
people
that's
get
one
so
thing.
exhausted.
And then
Yeah.
the other thing I would say, just to circle back to something I think is so important right now, kind of relating to that is, I think maybe, well, when was, you all know this better than I, when was the height of all these different availability things for well-being programs, you know, where you had this and this and this and this. Okay, we don't have that now. So some may exist, some we may still say on our websites that would exist and they don't. So we have to be really thoughtful around what do we have? What are we using? What could be used in this way too? And what do we need to drop off? Not just for financial reasons, but for confusion for employees. And so I think all of those things come together, and it may not be a thorough gaps analysis like what I was able to be part of, but it's a very functional look at that. And I'm sure Ryan has great comments on that, but those would be, you know, really my two things right now. And then really looking at what is the biggest thing our people need right now? Why are they you know, whatever it might be, right? We have so many that don't have healthcare, or can't afford the premiums. We have people, believe it or not, who are full employees who don't have sick leave or vacation time. And that's bigger than I realized in healthcare. So they're coming to work sick.
And hospitality and everything.
Hospitality.
Yeah.
So, you know, is there anything we can do on that end? Because that is really hurting people.
Well, it's huge. And it unfortunately happens in the higher risk industries that we have fewer resources. Ryan, I have some specific questions for you, but Didi, I wanted to just make a couple of comments. You know, you mentioned surveys, and one thing that really sticks out to me is that you mentioned we kind of do surveys more when we're in a crisis situation. And that's not a great environment to get, you know, really valuable feedback from folks. And then, you know, when you were talking about those job descriptions in HR, this is so interesting to me as an HR person. You know, HR is crafting the job descriptions, but maybe they don't necessarily know what the specific stressors are because that's not part of the job description. So that kind of cross-functional awareness is essential, not only with things like what are your benefits that are available to you in your wellness program, but what does your individual job look like? You know, what kind of specific resources do folks in your situation need? So Ryan, you know, you are hearing very, very directly, I'm imagining, from employees. They're opening up to you and they're saying things to you that they're not saying to their supervisors or HR. So when you are getting that kind of feedback from employees, what are the barriers that you're noticing or that you're observing from employees sharing that feedback with their manager?
Yeah, that's a a really good question. I think, you know, most people in that situation don't necessarily want to make waves, right? And that could be, you know, as Dee Dee alluded to, maybe they don't feel safe. Maybe, you know, the environment might not be conducive to it, or there's a perception, you know, just a perceptual gap between what should happen and what can happen. You know, with that being said, we tend to, you know, we look for trends, and especially with some of our clients that we work with doing on-site clinic, you know, we're doing things like utilization reports and trends. Obviously, privacy and confidentiality is of the utmost importance, but looking at, you know, trends and things that we're hearing from even just like a departmental standpoint, and looking for those opportunities to say, hey, it seems like at this one job station, take manufacturing, for example, this one job station we're getting a lot of neck pain people coming in from here. Let's do a little deeper dive into, how we can maybe better set up that workstation or create more movement variability at that workstation by rotating positions more frequently. I mean, those are very like practical, hands-on solutions that we would kind of dive into. Yeah, that's I think the trends say a lot, and it's not uncommon that we'll very quickly pick up on the trends.
Well, I appreciate that. I'm going to just put one more thing in before we close, Ryan, and this is specific to your business. Can I tell you, as somebody who's overseen worksite health clinics, the value of having a vendor who's local is incredible. We don't have a lot of opportunities like that on the West Coast. So I really appreciate what you're doing, and I'm very happy for your clients, because I think that's really valuable. For both of you, go ahead.
I was just going to say thank you. That means a lot. I appreciate it.
Well, it's really special and unusual, unfortunately.
Can I just add, Ryan, I remember probably 10 or 12 years ago when certain organizations on the East Coast were starting to do this, the functional and everything. And it's just great to hear that you're here and the successes you're having, because it's such an important part of all this.
That the credit goes to the amazing, and there are so many amazing employers out there that really do care. I think, that's Nicole, you mentioned there's a high percentage of closely held family business here in this area. I'm pretty sure it was you that mentioned that, Nicole. And we see that, and there's some great people doing great work out there. So yeah, all the credit goes to them for being supportive.
Well, I thank you both so much for giving us these incredibly valuable perspectives. I love that we are kind of taking this two-pronged approach, that we're able to look at systemic forces and organizational forces, and then we're also able to do these individual interventions that I think are extremely powerful for those folks, and definitely result in some pretty drastic positive change. So I appreciate you both so much. And I wish we had more time to chat about this, but I'm sure we'll get together soon. So, I'm going to turn the floor back over to Meredith, and thanks again, folks.
Thank you again, Nicole, for being our incredible host, even through our little technical issues. It would be a webinar without it, so we so appreciate you leading today's conversations, and to our incredible speakers, Ryan, Dee Dee, that was an amazing conversation, Dr. Schubert, Candace, and Dr. Dunn, for these important discussions today. As we close it out, it's important to acknowledge that the path of fostering workplace health doesn't start or stop here. And we want to ensure that you have the tools and your organization to be successful. This is why the American Heart Association developed the Well-Being Works Better scorecard to give employers a better idea of where their strengths and their weaknesses are and how they compare to peer organizations. The next scorecard submission window closes on October 31st, so we'll be sure to share that information before then. Thank you again to our local sponsors, OHSU Health, Providence Health Plan, and the Partners Group. Without you, this digital experience would not be possible. Thank you for your support of workplace health, for helping shape this informative event, and for continuing to be such wonderful community collaborators with the American Heart Association. And thank you to all of you, our experts, our attendees, for being part of this conversation today.